This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. You can follow, subscribe, and share on your favorite podcast platform. If you have questions or topic suggestions for Wendy, you can call us at 248-651-5010 or email at hello@nextstepsforseniors.com. Your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. If you have questions or topic suggestions, you can call us at 248-651-5010.
Hello and welcome to Next Steps for Seniors, Conversations on Aging. I am your host, Wendy Jones, and our topic today is really about easy healthcare. Because I will say this, it gets a little complicated. Anyone who's had a loved one in the hospital or had to transition into craziness, you know what I'm talking about. And that's why I have author and speaker with me today, Miss Lori-Ann Rickard. Rickard. I don't know why I said Rickard. It's Rickard.
Even my own family pronounces it both ways, so no worries.
I've known her for a long time. Anyway, so what's amazing is she has some incredible books that I think everybody needs to know about. But tell us first what geared you to do these books. Tell me how you got started on this.
Well, Wendy, I've been a lawyer for 39 years, but in the context of those 39 years, I really have worked in and around not only seniors, but physicians, hospitals, ambulance companies, and I was corporate counsel for a billion-dollar health system for 10 years. And so along with that and the fact that my father, who was a United Methodist pastor, super healthy guy, rode his bike 200 miles a week when he was 88 years old.
Oh, my goodness.
All of a sudden, here he had been this force of persons that, he took care of everybody in his community, his church. All of a sudden, he started to have healthcare problems when he was the most healthy person we knew.
Wow.
And so it was really my task, because I was the healthcare expert in the family, to figure out my dad's healthcare. And so as I talked to other people, people would say to me, why don't you write these down in little short booklets so that your average person who doesn't know some of the ins and outs of this stuff could also benefit from the information, which is how the books were born.
I love it. And this title, Before You Get Sick. And here's the reality. 70% of people need some kind of care as they age. So the chances are high something could happen.
Absolutely.
And why not have a tool book like this? And it's short. It looks like it's an easy read. It's not extensive, to really understand what to do before it happens. And that's why you're listening to this podcast, I'm sure, everyone, because they're like, oh, I need to know easy healthcare. I need to know what to do before you get sick.
Right. And the Before You Get Sick book is really just a concept that, like you said, 70% of people, like my father, had no concern about his health care. He was healthy, worked out, lifted weights, everything. And then 1 minute, something happens, right? Because as you age, we say aging is not for sissies. And so, the idea that prior to getting sick, that you have a list of all of your medical providers. For my father, I had, Excel spreadsheets with all the phone numbers, his medical information, his Medicare number, his Social Security number. And everybody in the family knew, because we have 6 kids in our family, everyone had access to that, so that it wasn't just me who knew what medications my dad was on. And, we've kind of taken that concept a little bit further at my law firm, and everybody who comes and gets an estate plan from us gets an emergency medical card, and that has all your medications, all of your allergies, everything on it, and it has your durable power of attorney, all of those healthcare documents you need, so that if you go to the ER or your doctor's office or anything, you can just give them that card and all the information is on there. So all of that becomes so important, because one of the things we don't do well in healthcare, I think, is coordinate care. We have lots of different doctors. It's the nephrologist, it's the cardiologist, and everybody is changing, your water pill, this, that, and the other thing. And that can really make you sick. And so you really need to plan for that emergent situation. We're not to the point yet where if you go, like in Michigan, to St. John or Henry Ford, to McLaren, to Beaumont, those medical record systems don't talk to each other. And so I learned with my father, who loved to go to Mount Clemens General. That's where he grew up.
Back in the day.
Yep. And, when his cardiologist was there, but then all of a sudden he was having a hip replacement down at Henry Ford, I needed a way to coordinate all of that information. And so you really need to think about that before you get sick, right? Because when your loved one's in the ER and you're trying to gather that information, it's really difficult to do and very overwhelming because you have a sick loved one that you want to pay attention to.
Exactly.
So that's the whole concept behind the Before You Get Sick book.
Well, and let's move into your hospital stay, because same thing. People have no idea what observation versus admission is in a hospital. For example, so when you come in to the ED, the emergency department, you actually get a full workup and they make a decision right there. Is this person medically necessary to stay here? Or is this just surface things that they can manage by going to their physician or some medication? And I'll tell you, everyone who goes into the hospital, into ED, the emergency department, thinks they're admitted to the hospital. They have a hospital gown, they're eating the meal, they got the curtain, everything looks like they're admitted to the hospital. But little did they know they're not.
Absolutely.
They're in what we call observation.
Yeah.
And I'm sure that's probably covered at some point in your book, but the reality of the situation is that has a lot to do with insurance too.
Right.
So these are things that are, we, myself and Lori Ann, are here to share with you because we want you to know this information.
Right. And your example about the ER, at one point in my career, I became a certified professional coder. And I still have that CPC today. And the reason why I do is because I learned, 10, 15 years in that I had to understand the healthcare system from the back end. And, another similar example to the admission versus observation is this concept that you're in the hospital and somebody with a white jacket comes in and says, I'm Dr. So-and-so, can you tell me about your what's going on with you? And you say to your family, oh, the doctor saw me today. Well, from my standpoint, I would say to my siblings, was it a doctor? Was it an intern? It could be a medical student. That's not your doctor. The person you need to know is who's you're attending. Who's the doctor that when they decided to admit you is your doctor for that hospital stay? It's actually not your internist.
Nope.
If you go into the ICU and they have what I call a closed ICU, that means the ICU doctors, the pulmonary specialists, they decide all your medication. Well, that's when your medication will get messed up, right? Because your internist or your nephrologist now is no longer in charge, of your water pill. So now people are adjusting it all the time. Mm-hmm. And that's when you as a family member, because your loved one isn't in a position to make good decisions because they're really sick. And so you need to be knowledgeable about how that hospital works. People think a hospital is like a hotel room. They think they're at the Bellagio, someone's bringing them a meal.
It's the furthest thing from
absolutely not. You want to get out of there as quickly as possible.
It's meant for acute settings.
It really is.
You come in, you get better, you leave.
Yeah.
You're not supposed to stay there.
Yeah, and especially if you're a senior, because when you're a senior, as is true of all of us, but especially as you age, your schedule is really important to your health. When you get sleep, when you eat. In a hospital, they wake you up every couple of hours, and you can easily get something called sundowners, which means you kind of go into this little amnesia type state. I remember my father saying to me, calling me my my sister's name. He's like, Greg, Steve, get a helicopter. Now, my dad went to Northwestern University. He had a master's degree. He was the smartest guy. But they had screwed with his schedule enough that he was really off.
He's like, get me out of here.
I recognized I needed to get him out. And that's when I needed to interact with somebody like you who would help me then figure out a placement for something my dad never in a million years thought he would need, which would be an assisted living place.
Well, and I love this conversation because it's so overwhelming for a senior, for anyone to be in the hospital, but specifically a senior. So let's just put ourselves in their position for a second. It is harder to hear. A lot of people have different dialects, and you're not only are you trying to hear what they're saying, but understand it, right? Right. So there's that, and then they take your hearing aids out half the time. They take your glasses, and then you can't find your glasses because you can't find your hearing aids because you don't have your glasses. Right. I mean, and then they come in and they're telling you pertinent information about your health, and you're just sitting there looking at them like, I can't even hear you. Right.
I mean, and this is the problem, you really need to have an advocate.
That's where I'm going with this.
You need to have an advocate, whether it's a family member, whether you even hire somebody. At times we couldn't have somebody with my dad all the time, and we had to hire a couple of hours to just give the family a break, But
and you had 6 kids. Imagine these people that had just only child, whatever the case.
Exactly.
They're call us at Next Steps for Seniors. Call Lorianne. We can advocate for you. I mean, this is so important to do, and there's companies that do this full time too. So the reality is, please have somebody with you, especially you ask them, what time is the doctor rounding?
Exactly. I was just going to say
and
that.
And then you have that advocate there.
And it's a particular problem in an ICU because I can tell you the ICU doctors regularly will round at 4:30, at 5 in the morning.
Oh, well, there you go.
That is very rare that you're going to have somebody there. So like when my dad was in the ICU, I purposely had one of my brothers go there quite early in the morning because if I missed that attending, I didn't know what was going to go on with my dad that day, and I might not see him again until 4:30 the next morning. Now, again, why it's so important to know who your attending is, get their number from the nurse, because if you do miss them rounding at 4:30 in the morning, because that's ridiculous, just because it's convenient for them, right? You have their phone number, and you should have a way to be able to get a hold of them. So at least at 9 o'clock when the family member comes in, they can give them a call and say, hey, I don't know what went on that day. But it's important, if you don't know who the attending is and who you talk to is the medical intern, who isn't in charge of anything, and Lord help you if they are. I mean, sometimes you just need help, so that person is a godsend, you know.
Yes.
But you really need to know who's doing what, and to assume that it's the Bellagio, where they know that what they're doing is running a beautiful hotel and everything's supposed to go so smoothly.
And the customer is the number one priority.
That's not a hospital.
Right. They have a lot of patients and a lot of things to do on a regular. So the other thing I want to mention, who's another very valuable person, is the nurse, who is the RN, the registered nurse assigned to your room. And usually on the wall, somewhere in the hospital room, you're going to see, here's my nurse, here's my case manager, here's my doctor. And that's important. As soon as you get to the hospital, I take a picture and send that to everyone you know.
100%. And it's going to change every 12 hours, right? Because everybody does 12-hour shifts. So you want to absolutely take a picture of that. But your nurse is your lifeline. You know, that is the person you want to be really nice to. If you can bring some cookies, great idea.
I always tell the families, bring snacks and goodies for the people that work there.
Exactly, because your nurse knows who the attending is. She knows when he rounds. She knows what his, issues are. He's in the OR right now. You might be able to catch him then. And, and if you're not necessarily meshing with the nurse, don't worry about it because you're going to get another one in 12 hours. But my youngest daughter almost died when she was born, and my mom was an RN.
Oh, goodness.
And my mom would tell you the nurse is much more important than the doctor because she's always there. And when my daughter was very sick, the nurse was the person that helped me the most because I was such a scared mom, and the nurse could tell me, your daughter just had a 9-hour operation. What's going on is very normal. Don't worry about it. Whereas the doctor's going to be there for maybe 10 minutes and then they're gone, right? So again, what we're saying is learn the environment, learn where you are, and advocate for yourself. And if it's not making sense, if your senior is getting disoriented, let's find the nurse and say, hey, we need to do something different. Maybe the medication is off, because they're not always right, and you have to call that into question.
Thank you for mentioning the medication, honestly, because that is a huge factor. And whenever you change any medication, not just in a hospital, I just want to say this out loud. And I'm not a physician, I'm not a nurse, but I want to say this out loud. Please, if you see some symptoms or something changing with your loved one, the first thing you think, did they change a medication within the last week or two? Because that could be an indication of that.
Swelling of the legs, disorientation. It can be something as easy as dehydration. Maybe your loved one needs some water, because they tend not to drink as much as they get older. But it could be, a UTI, and that can kill you, So you want to make sure you actually, you underestimate how much you know about your loved one and how you actually are with them on a day-to-day basis. My dad was 93 sometimes when he was in the hospital, and people sometimes assume that a senior's just not with it, that they don't get it. They're aging, they're older. I knew when my dad wasn't as sharp as a tack, he could see better than me, he could hear better than me, he knew everybody's name. When he started being a little bit off, I was the one who knew, hey, you got to take this seriously.
And you're the voice. I'm just going to say this. You are the voice for your loved one in the hospital. And I'm so grateful, Lori-Ann, that we had to have this conversation. How do people get a hold of your book?
Well, you can get them on Amazon. Just Google my name, on Amazon, Lori-Ann Rickard, and all the books come up.
Okay.
And so it's super easy to do if you want them. And they're fairly inexpensive. And they're really meant to be just simple guides that give you some pointers. Like you said, I'm not a doctor, but I think it's just practical information that's helpful to know.
Right. You and I, with all the experience and the background and the families and the things we've been through, why not share this information?
Right.
So please go on Amazon if you can, Lori-Ann, and then Rickard. Lori-Ann Rickard. And fantastic. You're a blessing. Thank you for what you do every day.
So are you,
Thank
Wendy.
you for caring. We just appreciate you so much. If you want to, we'd love people to call her for estate planning. Give your phone number because you're an amazing attorney. I just want to add. Please don't go to Google for your attorney needs. Please go to a specialist. So share your number, Lori-Ann.
My office is Rickard Associates. We're in St. Clair Shores, Michigan. The number is 586-498-0600. And we look forward to talking with you more, Wendy. You just really are a gift to all of us. We so appreciate everything that you do.
Thank you. Thank you. This is vital information. We all need to know it. So very grateful. You're listening to Next Steps for Seniors, Conversations on Aging.
This Christmas, give more than just a gift. Give encouragement, inspiration, and joy. In the Crosswalk Holiday Gift Guide, you'll discover a curated collection of meaningful books and devotionals that celebrate faith, family, and the real reason for the season. This Christmas, we invite you to share comfort, quiet, or excitement with each person on your gift list. From beautifully illustrated Bibles and devotionals to novels and picture books, this guide holds the perfect book for every reader, including yourself. So stuff those stories into stockings, wrap collections with care, tuck a book or two into your own nightstand, and join us in celebrating the wonder of reading this Christmas. Explore the Crosswalk Holiday Gift Guide and find something special for everyone on your list. Visit crosswalk.com/gift guide today.